Dear Dr. Agrawal, what are my chances of matching into residency? Now, this is a question that I get almost every day from residency applicants, those who are applying for the upcoming match and some who did not match in the last season. Now, I have strong feelings about this question because I really feel it's not a good question. In fact, I feel it's a terrible question because you are really doubting yourself. You're really doubting all the hard work you've put in, all the time you've put in, all your achievements and accomplishments when you're asking, what are my chances? In fact, if you want me to answer this accurately, my answer would be your chances of matching range from 0% to 100%. Why do I say that? Because I've worked with residency applicants who have had, say, long gap since graduation, more than 5 years since graduation, failed attempts, and folks who have changed their specialty, those who have been told by some mentors that, don't bother applying for residency, yet they still matched into residency. And on the flip side, I've also rarely seen some applicants who had stellar applications and did not match. So, really, there is no way of predicting what are the chances of matching. And really, are you going to not apply to residency just because someone told you that you're not going to match? Absolutely not. So instead, what I feel you should do is to focus on how can I have a super strong application for residency. Let's stop asking what are my chances of matching, and instead, let's ask what else can I do to strengthen my application, which is the focus of today's talk. Now, I feel the best way to explain this is something that is called a heat map. If you look in some of the scientific literature, there is this shades of color starting from red to green, where red means something that's problematic or harmful, and green means that's most ideal, the most perfect situation, because there are so many variables in your entire residency application. You can see right here, USMLE, US clinical experience, research, personal statement, ERAS application, your experiences. What we need to do is to try and hit as much greens as possible, all these green parts, to make a rockstar residency application. So let's look at some of these in more detail. So, of course, we'll start with the USMLE scores because that's one question that comes up. Your application is going to be very strong, very ideal if you're able to hit average score on USMLE. So for step 2 CK, I understand the score is about 247, and step 1, of course, now is pass or fail. And that also includes the OET. So the thing is, you're not going to be considered more favorably if your score is, say, 2A, 270, 275, instead of someone who has score of 250, 255. So once you hit average score or more, that's the best you can do for your USMLE scores. And as you go down, if you see here in the yellow-orange region, the lower you go below average, that's when it starts to become more difficult to get residency interview invites. The most problematic situation is if you have an attempt at USMLE, because not having the basic knowledge to function as a resident, it then becomes super difficult to get interview offers. That's why when I get asked about when should I take my USMLE, my answer is when you feel you're most prepared, you're best prepared to go ahead with the exam. Because also remember, I'm saying that it becomes difficult. It's not impossible. There are applicants who have had failed attempts still match into residency, but I do want to say it becomes super difficult if you have an attempt. So try your very best to hit average score. Like I said, you don't have to hit the highest score, but hitting average is a very good accomplishment. Now, this applies for step 1, step 2 CK, OET, of course. Now, step 3 is a little bit different because in the US, the step 3 is taken by, say, the US medical graduates. They take it in their first year of residency, but IMGs are taking it before residency. So in step three, even if you have like a low to less than average score, it's still something you can defend if asked in an interview, because you're taking this in a situation where you haven't started residency. But again, even for step three, I would highly suggest not having an attempt at that and do your very best, again, to hit average score in your USMLE. Let's go to the next question, which is the next aspect of your application, which is US clinical experience. Now, again, there's a variety of US clinical experiences available. What I feel is the best case scenario is having US clinical experience in a teaching hospital where, like a university hospital, where you have exposure to both inpatient rounds, with the resident team, with the attending, as well as on the outpatient side, hands-on experience, because the goal is to get letters of support. And having 4 letters of support is a very ideal situation. So this is really the best you can do for your application. Now, but of course, it's so difficult to get these kind of situations. The best way to do this is electives during med school, because that's when you can really get all these hands-on experience in a university hospital from teaching attendings who have written letters of support for other residency applicants. The next best case scenario is if you are in a private clinic, if you're pursuing US clinical experience in a private outpatient clinic, which is hands-on. And because the goal is to have as much practical hands-on experience, that really shows that you are well prepared for residency and can very nicely make that transition into residency. Less than 4 letters makes it a little bit less ideal, because the number of letters that residency programs ask, it's somewhere between is either 3 or 4. To be safe, I always suggest getting 4 letters of support. Observership comes a little bit in the yellow orange zone, because some of these observerships, yes, you can get it in university hospitals, teaching hospitals, and so forth. But again, not having active hands-on experience makes it a little less desirable. Telerotation is the next best option. No US clinical experience then makes it very difficult, because one, you're not going to get letters of support from US attendings. Yes, you will get letters of support from your home country, but then this really makes it very difficult for a program director to be assured that you can do residency in the US if you've not had any exposure to how the US healthcare system works. So definitely, stay away from no USCE, and you have a couple of options here to try and really strengthen your US clinical experiences. Research. So another aspect of your residency application is research, and these are the couple of options. Having a publication, so your article is published, you're the first author in a PubMed index journal. That is really the best case scenario, the best situation that you can have for your residency application. Now, of course, that's tough, because doing the research, getting it published, for the publication to then appear in a journal, all that takes many months. But I'm just highlighting that if you're able to do that, that's really the best thing that you can do for your residency application. All other kinds of publication, maybe you're not the first author, maybe it's in a non-PubMed index journal, so that's where it falls in this light green zone. Maybe it's a publication that's in process, that is, it's being reviewed by the journal, so it kind of falls in the second category here. Because what happens is, even if your publication, the manuscript that you wrote, is being reviewed, it's still something that you can share with the interviewer, that, okay, this is the manuscript that's been submitted, it's under review. You have something to talk about, something to share with the interviewer at the interview. And you can certainly write about your research experiences in your personal statement. Now, besides publication, presentation. So if you're doing presentation at an international conference, that really is it's another very good research experience. I've kind of put presentation below publication because, when these presentations are done, it's well known that many of these presentations don't result in publication, but still having a presentation for a residency application purpose at an international conference, first author or not, that really is a very nice research experience to show and highlight in your residency application. Other presentations, so if you did some kind of a research where you're just presenting at your med school level, or within the department, within the division, that's still okay. At least you're, presenting your findings. You're still aware of the whole scientific method to do research. That's still good. Now, non-transferable research. So that's where I wanted to take a little time talking, because I have worked with some residency applicants who were working in a basic science lab. So this is someone who's applying into a clinical specialty like internal medicine, family medicine, but they're working in a basic science lab, maybe with animal models, or PCR, studying those kind of techniques. And I always wonder, how is that going to help them become a better resident? It does not. It's a non-transferable skill. Yes, there's a little bit of, okay, I know how to work with others. I know how to, those are some research skills you can build, collaborating with others, doing a literature search and presenting your findings. But still, doing basic science research, if you're applying for a clinical specialty, it's not really transferable. And so I've kind of made it a less desirable research experience that you should be going for. No research, at least nowadays when everything is becoming so competitive, I do feel having at least some kind of a research experience is really going to strengthen your application, especially if you're someone who's applying into one of the university hospitals or university affiliated hospitals. It just becomes a very nice topic to talk about in your interviews, and it also sets you apart from everyone else. Best personal statements that I've seen have very interesting stories where they really start with it's called a hook, the first paragraph. They start with a very impactful experience, very interesting, very exciting story or event about themselves, and that really gets the reader to kind of go through the entire personal statement. So I've seen personal statements like that. Personal statements that are specialty specific. So, if you're writing about, say, neurology, so talk what you like about neurology, what your experiences have been. Those personal statements are very nicely received and really help strengthen your application. Showing instead of telling, that is showing examples of your experiences, say again in neurology, and what you have been experienced, that really strengthens your personal statement. I've also seen personal statements which are not personalized. So that basically means that you can just change neurology for another specialty, say even psychiatry, and even the whole personal statement looks like it can be used for any specialty. And some people do it maybe because they're applying to multiple specialties or for whatever reason, but that is something that makes your personal statement weak. And that's something I talk about in the course, how to really personalize your statement for the specialty that you're applying for. The personal statements that cause the most problem are ones that are repeating what you have described in the CV. So saying stuff like, I did my med school education at so and school, then I came to the US to do externship, and then I did research. No, that's not needed. But what's more needed is, what did you learn in those experiences that will help you become a better resident? And so that's what the show don't tell. That's what I was talking to you about. Not professional, that means having grammatical errors, spelling errors. I've even seen a personal statement that was just a half page instead of, you have a full page to write. Those look very unprofessional and can get you into trouble. So definitely stay away from that. All right, the next part is the eras, and we have more to talk about this. Having this gap since graduation, that is, I don't want to use the word problematic, but it really needs a lot of explaining that's needed. Less than 2 years since graduation for IMGs, I think that's very ideal because it takes so much time to get the clinical experiences, all the steps, and so forth. I don't think that's a concern. Not having gaps that is keeping yourself busy, either clinically at your home country or doing research, whatever. I think that's always very nice to show in your eras application. Having hobbies, hobbies is a section that gets very much overlooked. Show hobbies that are, say, unique, that are very interesting, hobbies like painting or traveling. Show interest in it. It really sets your application apart from others and makes for very interesting conversations during interview. 2 to 5 years since graduation, you have to start explaining what you've been doing since graduation, and that's where you have to either use that in your personal statement, and certainly it's going to be asked in your interview. More than 5 years, definitely you have to provide explanation what you've been doing since graduation, and that's something that I talk about again in the personal statement, why it's so important to address this red flag in your application. Having passive hobbies, I still see residency applications that say I love spending time with my friends and family, but that's not of much use. I love cooking. I love, that's those things are very passive hobbies and doesn't tell me much about you. So really, you really focus on trying to show your hobbies as active as you can, and that really helps. Lastly, experiences. So we've talked about clinical experiences. You must have heard that the ERAS application moving forward is going to have many more categories. Earlier, it was just the clinical, the research, and the community experiences, but now you have many more experiences you can describe, especially teaching or mentoring. The experiences that I feel are most helpful to you as a residency applicant are leadership skills. So these are situations, or these are positions in your med school or even beyond where you had an active role. You led a team of others, say medical students, maybe nurses, other students, into doing something, whether it's a cultural festival at your hospital, a conference at your hospital, a health camp. Those kind of leadership roles where you have an active role, you take active responsibility. Those leadership skills are very, very valued in residency. So having those kind of experiences and sharing that in your personal statement, and now in the new eras application, that's very much desirable and really strengthens your application. Having more of a team player role, I mean, it's still valuable, but again, the way the whole US work culture is, it really encourages and favors those who have had a leadership role. So if you're still in med school and planning for US residency, try to push yourself to have more active leadership roles, not just for residency, but for your entire professional career. Having these kind of skills and leadership are very valuable. So do your best to build that. So you must have seen so far, I've covered a lot of these aspects of your residency application and really, really try to hit as much green as possible. How you can use, these slides that I talked to you about. So say you don't have any leadership experience, try to then, get yourself towards the leadership roles if you can. If you are someone who has not had any research experience and are really in the red, try to look for research opportunities and try to get everything as green as possible to have, a really strong application. If your personal statement is kind of, somewhere on the average, somewhere where it's not strong enough from the feedback that you're getting from your mentors and so forth, really try to, strengthen that. And if you're USMLE, well, once you've taken the USMLE, there's not much to do there. But if you're kind of someone who has below average scores, you really have to push your application more towards the green. Maybe you're gonna have to, do more US clinical experience, really try getting it from a university hospital and so forth to try and get as many of the green zones as you can. So that's why I feel this is a nice way of understanding how can I strengthen my application for residency.